Welcome to Health Lit, your health education channel. The heart is the most vital organ in the body. It is referenced in music and poetry around the world. The heart is responsible for the world's most phenomenal creations and is the driving force of humanity. That which resides in the heart physically or emotionally can have a positive or negative impact on life. Are you taking care of your heart? Today on Health Lit we will briefly explain some physical functions and historical views of the heart and leave you with some tips to maintain heart balance.
A brief explanation of the heart. What is the heart? The heart is a muscular organ that pumps blood throughout the body. It is made up of 4 chambers, the left and right atria, and the left and right ventricles. The right atrium receives oxygen-depleted blood from the body and pumps it into the right ventricle, which then pumps it to the lungs to be oxygenated. The left atrium receives oxygen-rich blood from the lungs and pumps it into the left ventricle, which then pumps it to the rest of the body. The walls of the heart's chambers contract and relax in a coordinated way to pump blood efficiently. The heart also has its own electrical conduction system, which helps it coordinate its contractions and maintain a steady rhythm. How did the ancients view the heart? In ancient Egyptian culture, the heart was considered to be the center of the body and the seat of the soul. It was also seen as the source of a person's emotions, thoughts, and will. As such, the heart was highly respected and was believed to be the most important organ in the body. In Egyptian mythology, the heart was sometimes depicted as being weighed against the feather of truth in the underworld to determine whether a person was worthy of entering the afterlife. This concept was based on the belief that the heart was the repository of a person's good deeds and virtues, and that a heart that was pure and free of wrongdoing would be as light as a feather. There are many different philosophical traditions within Eastern philosophy, and each of them has its own views and teachings about the heart. In Buddhist philosophy, the heart is often associated with the mind or consciousness. The heart is seen as the center of one's being, and cultivating a peaceful and compassionate heart is seen as essential to achieving enlightenment. In the Hindu philosophy, the heart is also associated with love and emotions, and is often depicted as being the source of all human experience. Just as the Buddhist and Hindu philosophy, the Taoists see the heart as the center of the body and the source of one's vitality. In this tradition, the heart is believed to be connected to the kidneys, and maintaining a healthy heart is seen as essential for overall health and well-being. Overall, Eastern philosophy tends to place a great deal of importance on the heart and the role it plays in one's life and spiritual development. Emotions can affect the heart in several ways. Positive emotions, such as joy and contentment, can lead to a sense of well-being, and can lower the risk of heart disease. Negative emotions, such as stress, anxiety, and anger, can have the opposite effect and can increase the risk of heart disease. When we experience negative emotions, the body releases stress hormones such as adrenaline and cortisol, which can cause the heart rate to increase and blood vessels to constrict. This can put extra strain on the heart and can lead to high blood pressure and other cardiovascular problems over time. Additionally, chronic stress can also lead to inflammation in the body, which is a risk factor for heart disease. It's important to note that stress and emotions are not the only factors for heart disease. Other factors such as genetics, diet, and lifestyle also play a role. However, managing stress and negative emotions through techniques such as mindfulness, meditation, and therapy can help reduce the risk of heart disease and promote overall well-being. What are the pathologies of the heart? There are many different types of heart conditions that can affect the heart. Some include 1. Coronary artery disease. This occurs when the arteries that supply blood to the heart become narrowed or blocked, which can lead to chest pain, angina, and heart attacks. 2. Heart failure. This occurs when the heart is not able to pump blood effectively, leading to symptoms such as shortness of breath and fatigue. 3. Heart valve disease. The heart has 4 valves that help regulate the flow of blood through it. If one of these valves becomes narrowed, stenosis, or leaks, regurgitation, it can disrupt the normal flow of blood and lead to heart problems. 4. Cardiomyopathy. This is a general term for conditions that affect the heart muscle, making it weaker and less able to pump blood effectively. 5. Atrial fibrillation. This is a type of irregular heartbeat in which the atria, the upper chambers of the heart, contract in a disorganized way. It can lead to an increased risk of stroke. 6. Heart infection. Infections of the heart, such as endocarditis, an infection of the inner lining of the heart, can be serious and potentially life-threatening. What are the signs of a heart attack? Symptoms of a heart attack can include chest pain or discomfort, shortness of breath, nausea, lightheadedness, and cold sweats. Other common symptoms include pain or discomfort in the arms, back, neck, shoulders, stomach, or jaw, and a sense of impending doom. However, it is important to note that these symptoms can vary and not everyone experiences chest pain. If you suspect you or someone else is having a heart attack, it is important to seek medical attention immediately. Certain foods can contribute to the buildup of plaque in the arteries, which can increase the risk of heart disease. These foods include foods that are high in saturated fat, trans fat, and cholesterol. Examples of such foods include fried foods, such as fried chicken and French fries. Processed meats, such as bacon, sausage, and deli meats. High-fat dairy products, such as whole milk, cheese, and butter. Animal fats, such as lard and shortening. Tropical oils, such as coconut oil and palm oil. Just as the human heart can experience physical dysfunction, it can also experience emotional dysfunction. This emotional dysfunction is described as a broken heart. A broken heart, what are the symptoms? Broken heart is a colloquial term used to describe the emotional pain or suffering one feels after a breakup or the loss of a loved one. It is often associated with feelings of sadness, disappointment, and despair. It's important to note that the physical symptoms such as chest pain, shortness of breath, and other symptoms that some people experience during emotional stress can be similar to those of a heart attack. Now that we have discussed some of the risk factors and conditions of the heart when it is out of balance, here are some tips that can lead to solutions. How to maintain a healthy heart. Foods that are good for the heart include fruits and vegetables, whole grains, lean proteins, and healthy fats such as avocado, nuts and seeds, and olive oil. Fish, particularly fatty fish like salmon, is also beneficial for heart health due to its high levels of omega-3 fatty acids. Limiting processed foods, added sugars, and reducing saturated and trans fats can also help promote heart health. Brisk walking, jogging, cycling, swimming, and dancing are good for heart health because they increase the heart rate and improve cardiovascular fitness. Strength training, such as weightlifting, resistance band exercises, and body weight exercises, can also be beneficial for heart health as they increase muscle mass and improve metabolism. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity a week, or a combination of both, preferably spread throughout the week. Additionally, they also recommend incorporating moderate or high-intensity muscle strengthening activity, such as resistance or weights, on at least 2 days a week.
Change. The only thing that is constant and promised in this world. Negative or positive depends on one's perception and the future one wishes to create. Life is to be experienced and enjoyed. Eat the food, drink the wine, and enjoy the pleasures of life, but do so with moderation and responsibility. Keep in mind that there is a fine line between medicine and poison. If the scales have been tipped in your life, try observing balance. Health is the greatest wealth. Without it, the tasks of destiny become challenging. Are you listening to your heart? Are you taking care of your heart? Are you responsible and aware of how you deal with the hearts of others? Is your heart heavy? Is your heart light? Or is it balanced? This Valentine's Day, as you focus on the love you have for others, don't forget about the love for yourself, which is the most complex and greatest of all. Take care of your heart, and have a wonderful and health-conscious day.
If you enjoyed today's presentation, please subscribe, like, and share.